Now, the winter season also marks the onset of the flu season, coupled with a virus that's not slowing down. By most estimates, the winter season will drive up the infections. And all of us who have been patiently waiting for 2020 to end may find that the pandemic will not end with this calendar year. Here's a report.
Time for doctors. The seasonal flu strikes, cough and cold spread. It's an annual test of human immunity. This year the test will be much tougher.
You know, in winter we go into close quarters, and that is, providing the virus with more people to infect at a closer range. So that risk is very much there, and it is very likely that we are going to experience, another surge until the vaccine is available, really, to try to counter it.
For perspective, look at what previous winters have brought. Last year in the United States, cases of the flu spiked by 40 times during winter. A century ago, during the Spanish flu pandemic, it was the same story. The year was 1918. The death rate shot up by 5 times during winter. Now we have a deadly virus on the prowl. It has killed more than 1 million people in the last 8 months. Will the winter supercharge the Wuhan virus? It is difficult to say.
And we'll pull out the tube as we do that, okay?
The outbreak began during winter in Wuhan. That was last year. The data is A, not trustworthy, and B, devoid of a pattern. What about previous pandemics? Have they worsened during winter? The world has witnessed 10 respiratory pandemics in the past 250 years. In only 3 cases did the winter contribute to a second wave of infections. Does that mean we have nothing to fear during winter? Experts are relying on basic logic to recommend caution. The first wave killed far too many people. The second one could be deadlier. It will coincide with the flu. Both have the same symptoms. Simultaneous outbreaks would strain healthcare systems. And there's no effective vaccine in sight yet. The most optimistic expectation is to have a vaccine by 2021. 45 vaccines are in clinical trials on humans. Even with the unprecedented speed of testing, mass vaccination programs are many months away. The chief scientist of the WHO says the young and healthy may have to wait for the vaccine until 2022, as the first supplies will be administered to the healthcare and frontline workers. As always, China remains the exception to the rule. It is cutting corners and administering vaccines under trial to thousands of citizens. Chinese companies are selling vaccines too. Reportedly, Sinovac is selling 1 dose of its CoronaVac vaccine for $30. CoronaVac is a vaccine candidate. It is yet to receive a global stamp of approval. But according to different reports, China has inoculated tens of thousands, if not more, under an emergency use program. All this while the world is still struggling to contain new clusters, reinfections, and a virus that is showing no signs of slowing down. Bureau Report, WION World is One.
Co-presented by Skoda. Simply clever.